Hello everyone, I'm Dr. Umar Malik and welcome to Med Simplified. Vitamin D, also known as the sunshine vitamin, is a big topic right now. It comes as a surprise for most people because they have never really had a problem before, and most of us believe that a low vitamin D level changes nothing and it will not be a problem for us anytime soon. Well, now vitamin D deficiency and insufficiency is a global public health problem. A conservative estimate tells us that more than 1.3 billion people worldwide are deficient for vitamin D. So in this video, we will talk about how vitamin D deficiency is a serious issue and why you must take active steps to treat vitamin D deficiency. Vitamins are considered as essential nutrients because either your body cannot make them or they are made in inadequate amounts. They prevent negative health consequences or diseases and are vital for the optimum functioning of our body. But vitamin D is special. Unlike other vitamins, it can be made by our body when exposed to sun, hence the name sunshine vitamin. An estimated 80% of our total vitamin D in our body comes from sun exposure to our skin. Terms like rickets and osteomalacia are commonly thrown around when you talk about vitamin D deficiency. But research and years of clinical experience has shown that the health consequences of vitamin D deficiency not only affects the bones, but has far-reaching consequences for the whole body. Researchers have found an alarming number of health issues outside of its role with bone diseases. These include certain cancers, obesity and cardiovascular diseases, autoimmune diseases, certain infections including COVID-19, inflammatory bowel diseases, and mental health issues including various psychological and cognitive disorders. So keeping that in mind, let's start from the very beginning. Let's look at what are the common causes of vitamin D deficiency. The reasons vary from insignificant causes like inadequate exposure to sunlight and more serious conditions like kidney and liver problems. Number 1. Dark skin color. Melanin is what gives skin its color. Light-skinned people have less melanin than those with darker skin. Melanin is important because more melanin means darker skin and darker skin means natural sun protection. However, as less sunlight can cross the skin, dark-skinned individuals require at least 3 to 5 times longer exposures to make the same amount of vitamin D as a person with a white skin tone. Research has also proven that African American population has a mean vitamin D level less than that of white Americans. Number 2 is limited exposure to the sun. This is by far one of the most common reasons of vitamin D deficiency today. As industrialization progressed, we tend to spend more time indoors. Most adults work indoors and wear more clothing during the work week, which leaves only minimal of their body exposed to sunlight for short periods, so they cannot meet their vitamin D needs through the sun alone. Even if you do have some exposure to the sun, the total amount of vitamin D you can produce is affected by many factors like the season, time of the day, ozone amount, latitude, and the number of clouds in the sky. Additionally, increased awareness of skin cancers has led to an incremental rise in the use of sun protective creams, which are known to decrease the vitamin D synthesis process. Number 3 is being overweight or obese. Being overweight or obese may put you at a risk for vitamin D deficiency. A recent review of 23 studies has shown that obese people had 35% higher rates of vitamin D deficiency compared with the normal weighted subjects. While diet and decreased sun exposure may have some impact on this, there appears to be an increased need that cannot be met without a supplement. Number 4. Malabsorption and unhealthy diet. People who have nutritionally underwhelming and insufficient diets are at a higher risk of developing vitamin D deficiency. Also, people with a history of previous gut surgeries, unhealthy gut, and malabsorption syndromes, for example Crohn's or celiac disease, are often unable to absorb enough vitamin D from their diet, which leads to a deficiency. Number 5 is certain medications and medical conditions. A wide variety of medications including antifungal medications, anticonvulsants, steroids, and medications to treat AIDS and HIV can enhance the breakdown of vitamin D and lead to its low levels. Also, conditions like liver failure and kidney failure interfere with the body's natural pathways of synthesizing vitamin D. If you are interested in learning more about how our body synthesizes vitamin D and how vitamin D acts in our body, we'll be uploading a video sometime soon, So make sure to subscribe to our channel and hit the bell icon. Well, now that we know why vitamin D deficiency occurs, we can now ask the question, what are the health risks of vitamin D deficiency? Looking back in the mid-1600s, two gentlemen by the name of Whistler and Glisson reported that children living in industrialized cities in Great Britain had short stature and had deformities of the skeleton, especially of the lower legs, a disease well known today as rickets, which occurs due to the vitamin D deficiency in children. However, it wasn't until 1889 that physicians discovered that sunbathing was important for preventing rickets. Since then, many other health benefits of vitamin D and risks associated with deficiency have been reported. Let's take a look at a few of these. Number 1 are skeletal diseases. Now, this is a common knowledge that vitamin D is important for your bones. But how exactly that happens is as follows. Vitamin D enhances the absorption of calcium and phosphorus in your diet, and without it, only 10 to 15% of calcium and phosphorus are absorbed from your diet. Thus, vitamin D maintains the optimum blood calcium levels to enable your bones to remain healthy and strong. Vitamin D deficiency leads to bone loss, osteopenia, osteomalacia, osteoporosis, and eventually increased risk of fractures. Also, there are vitamin D receptors in human muscles that have a direct effect on muscle strength. This is evident from the fact that severe vitamin D deficiency can cause myopathy or abnormal muscle function, which can cause muscle weakness and pain. Treating vitamin D deficiency in elderly population has been shown to decrease knee and hip pain. A study of 769 older adults aged 50 and 80 years found that moderate vitamin D deficiency positively predicts the incidence of worsening of knee pain and possibly hip pain over the next 2 to 5 years. Number 2. Autoimmune diseases. Autoimmune diseases are those disorders in which the body's defense mechanism misfires and starts acting out against the body's own cells. Now, where exactly does vitamin D fit in the case of autoimmune diseases is unclear, but there has been research that shows a definitive link between vitamin D deficiency and developing autoimmune disorders. Now, take for example the case of type 1 diabetes in Finland. Type 1 diabetes is also an autoimmune disorder. The recommended daily dosage of vitamin D was gradually reduced from 4,000 units per day in 1964 in Finland to 400 units per day in 1992. During this period, the incidence of type 1 diabetes increased by more than 350% in children aged between 1 to 4 years. Even more convincing data came in 2006, when Finland authorities made it mandatory for all dietary milk to be fortified with vitamin D2. And following which the incidence of type 1 diabetes plateaued and began to decrease. Similarly, current evidence supports that vitamin D deficiency increases the risk of developing multiple sclerosis, which is another autoimmune disease. And vitamin D supplementation alters the disease activity in people with multiple sclerosis. Also, a review of studies shows that in people with multiple sclerosis, having adequate levels of vitamin D were associated with fewer relapses. Also, they had lower risk of development of new lesions in the brain, had lesser disability and lesser disease severity, and better long-term memory. Number 3. Cancer. Cancer is a dreadful disease, and unfortunately we are still struggling to fight it effectively. Years after years of research have tried to isolate the various risk factors that potentially cause cancers in humans. One such risk factor being studied is vitamin D deficiency. A number of studies have investigated whether people with higher vitamin D intakes or higher blood levels of vitamin D have lower risks of specific cancers. The results of these studies, however, have been inconsistent. But these studies have suggested that there may be an association between increased risk of various cancers, for example, colon cancer, breast cancer, ovarian cancer, skin cancer, and prostate cancer among people who are living far from the equator. Since these people get fewer sunlight exposure to the skin, they have an increased prevalence of vitamin D deficiency. Number 4. Cardiovascular diseases, also known as heart diseases. The term cardiovascular not only refers to the heart but also to the conductive vessels that help the heart push blood to the whole body, namely the arteries, veins, and capillaries. A review of 6 studies that included over 6,400 people found that patients with cardiovascular disease who additionally had lower levels of vitamin D had more severe and advanced diseases compared to those who had optimum levels of vitamin D. Vitamin D deficiency is associated with an increased risk of hypertension, that is high blood pressure, also hyperlipidemia, also known as high cholesterol, peripheral vascular diseases, coronary artery diseases, myocardial infarction or heart attack, heart failure, and stroke. The anti-inflammatory effects of vitamin D may be the reason for this, and studies are ongoing to examine this relationship. Number 5. Increased prevalence of infections. It's possible that maintaining adequate vitamin D levels could lessen the length and severity of upper respiratory tract infections and possibly even prevent them. This was proven by a review of 12 studies including 2,279 children. The study found that children with lower respiratory infections had significantly lower vitamin D levels compared with normal healthy children. Also, there was a relationship between how low the vitamin D level went and how severe the infection was. This is especially important in the current scenario of COVID. A latest study in Israel had surprising results. The researchers found that being deficient in vitamin D before contracting COVID-19 had a direct impact on how severe the disease will be and eventually how lethal it became. The study revealed that 26% of the people who had a pre-infection deficiency of vitamin D died, compared to only 3% of those who had higher levels of vitamin D, a staggering difference of 23%. While the researchers do not point to vitamin D deficiency as being the cause of death, it states that if vitamin D levels were low, the disease was severe and there was increased mortality in an independent manner. Whether or not vitamin D supplementation helps in COVID-19 is still under study. However, the author of the study says that it is vital that people maintain a healthy level of vitamin D in their body, as it may help them fight against COVID-19 infection. Well friends, with this we come to the end of this video. Stay tuned for more such content and leave a like or a comment if you'd like to know more about vitamin D. You can also consider becoming a member on our YouTube channel or support us via Patreon. Do comment in the comment section below for some topics for you like to make us a video about. We at Med Simplified are committed to bringing you the latest content. Till then, take care, stay safe, and do treat yourself to some good sunshine every now and then.